morning. The Ford government still facing criticism tonight for its controversial plan to move seniors from hospital into a long-term care home that they may not have chosen. And if they don't go, they could face daily fees. Tonight, a doctor tells us the impact this is having on his elderly patients.
They basically said, I'd rather be dead than be in a home that I wouldn't even put my dog into.
Dr. Samir Sinha is the director of geriatrics for Sinai Health. He's concerned patients won't seek the help they need because they don't want to be sent to a long-term care home away from their communities.
There's a lot of fear and there's a lot of terror. A lot of my patients are now saying to me when I have conversations about this that I don't even want to go on a list. I'm even afraid of coming to a hospital if the end result is that I could be placed in a home that I never wanted to be a part of.
Under new legislation, a placement coordinator can pick a home for a patient who is waiting in hospital for a long-term care bed and authorize their admission without their consent. The government hasn't released guidelines on how far away a person can be placed from their community. Sources tell CityNews distances being considered are anywhere from up to 300 kilometers away in the north to 30 kilometers away in a city. The Ford government did not deny the numbers, but says they're just a starting point as they consider the impact, and no decision has been made.
The opposition want people who should be in long-term care in hospital beds. Hospital beds weren't made for long-term care patients. And what's happening is clogging up the emergency departments.
Today, Doug Ford addressed the new legislation for the first time since the Minister of Long-Term Care acknowledged people who don't leave a hospital when a long-term care bed is available could be billed the uninsured rate, which is about $1,500 a day.
Should a hospital charge them? Absolutely, because we need those spaces for patients who need acute care. We need them for surgery.
The government is trying to ease the strain on hospitals and increase capacity amid staffing shortages as the fall season approaches. Currently, about 24% of people in hospital are ready for discharge, but need another form of care, like long-term care.
What is the solution to this problem that has been building for years?
Yeah, so if you go to countries like Denmark, they don't actually have this problem. They solved this problem years ago by making sure that 2/3 of their long-term care spending was around the provision of high-quality home care. The reason why so many people, so many of my patients end up on long-term care wait lists in hospitals or out in the community is that we don't have enough home care being provided.
Dr. Sinha says there are 15,000 people on a wait list for home care and points out that home care costs are about half of long-term care costs.
This is why we're actually creating our own problems. And instead of fixing our problems, we're now just simply calling the problem older people, calling them bed blockers and saying, you know what, you need to free up this bed so other people can use it.
The government says more details in the legislation will be released a week after it is passed and becomes law. There's no timeline for that yet. I'm hearing it could be next week. There are no committee meetings scheduled on this bill, which means the public will not get a chance to give input.